Welcome to our discussion about men's mental health. I'm joined today by Dr. Tim Romanowski from Warrior Medical. He's a board certified family physician specializing in primary care and sports medicine, as well as Brad Masters. He's CMO, Director of Client Experience at the Mood Center. So I hope you enjoy our conversation today. Thank you. You guys have been a wealth of information, and I do want to understand, what are some of the biggest threats that are facing men's mental health today?
One of the biggest threats facing men's mental health is ourselves. We don't want to be vulnerable. We don't want to recognize it. We don't want to reach out for help. And that leads us towards that isolationism. That leads us to increasingly more desperate thoughts. And if we can overcome ourselves, we can become vulnerable. We can reach out.
Yeah, I think perception is everything. I think it's how we view these things. I think it's how we've traditionally viewed these things. When we can start, which they really are, when we can start viewing things like vulnerability, self-exploration, exploring your emotions, where are your thoughts coming from, where's all that coming from, and being open to seeking help for it or asking for help for it, when we can start to view that as strength and not weakness, when everything will change. And I think we're at a pivotal moment where we can make that happen. Again, I don't think uh, traditional masculinity or the way that society thinks of men traditionally and vulnerability or exploration, they're not mutually exclusive. They're one and the same, and they need to be seen that way. And maybe, what's the definition of a man?
Part of manning up is understanding ourselves.
Term's been misused. You know what I mean? As stepping up.
Could you define manning up?
Yeah, manning up is being able to do what you have to do the right way. Explore yourself the right way. It doesn't mean shove everything down. It means explore it. It means show up for your family. It means show up for, for yourself, for those around you in the right way, not the easy way. The easy way is to shove it down.
Easy way is to shut down. That's what we've been taught through generations. But it's not that's the easy way. And part of manning up is taking that hard road and exploring ourselves.
The interesting thing is what you're doing by doing that is you're just delaying the inevitable, and you're making things worse down the road. The hard times are going to come. You can't run from these things forever. And so by taking it on upfront and doing what you have to do to own yourself and own your emotion and explore it, you're saving yourself, your family, potentially a lot of grief down the road.
And when those hard times comes, that's when we get that fight or flight response. And yes, you can fight, but then realize what's going on, or fly away. But you have to understand where that came from. How is this impacting my family? How's it impacting me?
Asking for help is a very hard thing to do. It it can be I struggle with it, almost every time. Um,
In the medical field, I remember as part of my training, I did 2 years of surgery residency before changing over to family medicine. It was ingrained in us, and this was said multiple times during the day by multiple of my attendings. Feel free to ask for help. Just remember, asking for help is a sign of weakness. And that has an impact, especially on a young, impressionable doctor, surgeon. It makes us feel like we are alone. We can't collaborate with anybody. And that's what we need. We need that collaboration.
So, um, what are some root causes from that? I know a lot of men have talked about having that do end up being vulnerable. Talk about mommy and daddy issues. Is there any common threads of what you see are most popular of root causes from men, turning in and not being vulnerable and not dealing with their emotions healthy?
I think it's different for everybody. I mean, there's so many. It's what came first, the chicken or the egg. I mean, seriously, it's everybody's story is so unique and so different. I think commonly, yeah. I mean, I think we don't do a very good job of teaching our kids in the society of how to deal or handle your emotions right now. We don't. Um, I think broken homes, generational trauma. I think when it comes to chemical imbalances, sometimes there's a root to that. Um, so it's really different for everybody.
So, is men's mental health lower overall today than in past years, or is it just looked at differently? I mean, we've experienced many years where it might have been labeled differently in the past than it is now. So, if you guys could unpack that for me, Tim.
That's a really good question. I mean, are we just more aware of it in today's society? And if we look historically, stories in the Bible, we attribute these mental health issues to demon possession. And then at some point, they just become, oh, it's a physical manifestation of X, Y, and Z. Oh, no, now it's a chemical imbalance. And we just don't know what to do with it. It's always been kind of, I hate to say a fringe area through the years. I mean, you had insane asylums where people were just locked away because we didn't know what else to do. We had horrible treatment of these people. But now, as society has changed, medicines has changed, we understand it better. So, are we recognizing it more, or is men's health really lower? It's hard to say. Maybe it is a combination of things.
Yeah, it actually could. The awareness could be a very, very good thing. And I think it's important. I mean, the fact that we're sitting here today having this conversation is a testament to that. I think it's super important that we continue to talk about it and we continue to move the conversation forward. I think it's also balance is so important in this. I don't want to lose sight of what people would term, traditional masculinity, strength, and drive, and those kinds of things. We can't lose sight of that too. That's important. That's natural. It's important, but the balance is what's key.
You're right. We cannot lose that traditional masculinity because we have, as men, we have this innate desire to be the hero of our own story. We don't want to be, cast as second tall man. We are the hero. There's a dragon we have to slay. There's a princess that needs saving. And those are at the core being of the man. It's like what drives us. But then, oh, I'm now having this thought. I can't go past that. I can't slay that dragon. Oh, now that thought is my dragon. How can I handle that?
It all boils down to what is our identity internally, and we can start to shift that thought of some of these things are strong, and they could be put together with my traditional roles of masculinity, and I view myself as strong. I think it's a good place to be.
That's a really good analogy of a demon to slay, a dragon to slay, and a princess to save. And I think at the core of who men are, that's certainly our desire, right? And we want to win. And I think that that's what keeps us going. What are some ways that men can put that into a healthy balance? Because one of the things that you brought up was, balance, right? And not knocking people in the face and kissing random women on the cheek, right? So
I think it's taking the time to understand the tools that you have. It's like, and I was guilty of this when I was younger. It's like if, in terms of strength training, it's like if all you do is go to the gym and power lift and you never take the time to stretch, you're gonna end up hurting yourself. Same kind of thing, right? If all you do is move, and you never take the time to go inward, you're gonna end up hurting yourself. And it's all about that balance.
It's recognition of the next step. Like you said, with strength training, you need those rest periods. Same thing. We cannot continue to fight without resting and reevaluating. I mean, basically, that's how wars are won battle by battle. And so you go through a battle, suffer loss, you reevaluate what happened. You go on to the next battle. You learn from your mistakes. It's that recognizing of our own selves, our own weaknesses, our own strengths. How do we move forward?
gentlemen, there's many ways emotions come out: physical, mental, spiritual. And I would love to hear what are some differences between being sad and being depressed. in those categories, maybe, or however you see that difference being?
Let's try to define this first before we explore these other topics. So when the general public hears the term "you're depressed," they think it's just a sadness. Oh, and when we experience sadness, with different events in life. We have a loved one dies, a pet passes away, um, football team loses the championship. Yet we all internalize it as a sad event. But that's not a depression. Depression is much more guttural. It is to your core. I mentioned before, you feel the darkness, you hear the silence, you embrace the loneliness. Yes, you're sad, your mood is just so down. There's no light out there. And you start withdrawing, you turn inward. Nothing external is going to fix this. Nothing internal is going to fix this. It's me against the world. It's me alone. It's me against myself. That's depression. And there's no reaching in. There's no to get out of it. It's so in our core that it's who we are. It's who we become. And for some people, unfortunately, that's the end. But other people, they can find help. Sadness has an end period, but sadness can propagate, become even deeper. That's when we get that depressive state.
Yeah, sadness is a state. You a reaction to an event typically, or a reaction to something that happens in your life. Depression's something entirely different. To your point, I mean, the things that you used to derive joy from or get joy from, you don't anymore.
There's no joy, there's no hope.
Zero. Completely withdrawn from your friends. And there's levels of depression. There's stages of it. And sometimes, grief is the cause of a severe depressive episode. But it's very much more a chronic state than, I'm sad about a certain situation in my life. I need to grow from a certain situation. My something didn't turn out the way I wanted it to. Now, can those things snowball? Absolutely. Yeah. Negative self-talk is typically very ramped up with depression. I'm not good enough. I couldn't do that. You're kind of constantly beating yourself up. Those kinds of things are things to look for. But chronic depression it's a very dangerous state.
Somebody once said to me, pull yourself up by your bootstraps, right? And I would say that somebody in depression might not have boots. Are there different levels of depression?
Yeah, definitely. And you're not. That's the thing about severe depression is a lot of times you're not able to. You can't see the light. There's not something that you can think, okay, well, maybe I'll go do this and I'll feel better. Or say you've tried to do things that used to bring you joy before and it's just not working. The joy is not coming. That's to your point. There's no boots.
So what's somebody suffering from deep depression like that? What's one thing that you would want to say to them right now?
There's hope. There are people out there. You're not alone.
Yeah, it can get better. Hope is so incredibly powerful. It's hard to implant hope in somebody when they're dealing with depression like that, or suicidal ideation, or those negative self-talk. Consistent negative self-talk is ramped up. It's hard to implant hope because they just can't see it. They just but it's one of the most powerful things you can do. If somebody has even a glimmer of hope and you water that seed, it can grow and it can change everything. But implanting hope, 100%.
So men who are listening right now, how can they start improving their mental health? Tim, you obviously run Warrior Medical, and Brad, you are the CMO over at the Mood Center, and I want you to take those experiences from where you're at and just give some real life, like, hey, this is what I can grab onto of, what's a good next step? What are some things that you see are working? Knowing that there's, as you say, Tim, there's no cookbook answer, right? There's no 1 and 1 equals 2. It's much more diverse than that. So
It's very much diverse than that. I mean, someone could have a very mild depression that is resistant to traditional treatment. Someone has a very deep depression, you give them a little SSRI and they're back to normal. So unfortunately, patients don't read the textbook. They don't know what they're supposed to feel, how they're supposed to react. First thing that men can do is recognize in themselves what is going on. Two, reach out, friend, spouse, your doctor, and start the conversation. There's so many resources out there, therapists, counselors, psychiatrists, and then your family doctor. I mean, most of what I do is about 60% of family medicine is behavioral health. So, and that's where we start. Come in, and yes, I have a bunch of different screening tools for anxiety, depression, ADHD. But a lot of times I'm looking at a mixed picture. I would like to say, hey, one treatment will cover everything, but it's not. It it's what is your need? Where can we go? Where can we help? So traditionally, we've done things like the SSRIs, your Prozac, your Zoloft. They have newer ones, SNRIs. Um, there's a lot of drugs out there. We found like, hey, this drug is treating this other condition, but hey, it works really well for depression. Or this used to be a depressive agent, antidepressive agent, now it treats something else. So unfortunately, medicine's changing. I don't have a good answer, and everyone reacts to medicine very differently. Just because you're on Zoloft or sertraline doesn't mean the next patient's going to do well on that. I have to go to different things, and we can try more homeopathic medicine, some herbal remedies, like St. John's wort can help elevate mood, but talk therapy, cognitive behavioral health therapy is very important. It teaches you how to deal, how to act, and how to react. The medicines I can provide just help to rewire, stabilize those chemical imbalances. But there are more, innovative therapies out there for things like post-traumatic stress disorder. We can do stellate ganglion blocks, which turns off that fight or flight, and it helps with those traumatic experiences. And there's stuff that the mood center is doing, like ketamine treatments, which are revolutionizing everything and are helping our patients.
so what's ketamine treatment?
Yeah.
Saying
So
that right?
yeah, ketamine,
Okay.
ketamine treatment. So yeah, we do ketamine and Spravato, S-ketamine, which is a derivative of ketamine. It's a nasal spray. Ketamine's administered via IV or IM. But it's really been a game changer for mental health and kind of the way we think about it and the way we're able to treat it from a medicine standpoint. So traditional medications work wonderful for a lot of people. Essentially, what they've since Prozac came out in the 80s, I mean, they're essentially going in and they're turning the volume up on different chemicals of the brain. Serotonin, dopamine, GABA, different classes work on different things, but ketamine's very different. So ketamine, first of all, most of the time you don't have to be on it forever. It doesn't come with a whole host of side effects that traditional medications come from. All the risk of side effects with ketamine are during the infusion, and everything's medically monitored, and they're relatively mild, high blood pressure, nausea, things like that. But the way it works is what's really, really interesting. So it works on something called neuroplasticity, or the brain's ability to adapt. So there's a doctor that uses an analogy that I love when it comes to this. He says, imagine you've been skiing down a ski slope for 26 years. Eventually you develop all these ruts in the snow, and you can't help but ski down the same rut over and over and over again. Ketamine's like a fresh blanket of snow that comes and fills the ruts. And so now you have the ability to build new ones. And I love that analogy because one, it speaks to ketamine's ability to kind of, when administered on a certain protocol, prime the brain for change. But also, it speaks to how important developing new healthy patterns is in your life. The other thing that it does is so it goes in and it blocks a certain receptor in the brain called the NMDA receptor. This NMDA receptor sits on an inhibitory neuron. So when you're dealing with depression, anxiety, trauma, PTSD, a lot of times you're stuck. You can't see a way out. You can't. There's no boots. You can't pull the boots up, right? So it would be like if you had your foot on the gas and the brake at the same time. When that inhibitory neuron gets blocked, it's like taking your foot off the brake, but your foot's still on the gas. So not only is your brain primed for change, but at the same time, you have the motivation to shift. And that's a powerful combination. It also, during infusion, shuts down something called the default mode network in the brain, which is why it works so well for suicidal ideation. So it's hypothesized that that's where the ego is. It's also where all negative self-talk is housed. So we talked about planting a seed of hope. So, imagine if you've got these chronic negative self-talk thoughts going through your head constantly, you see no hope. And before long, that becomes suicidal ideation. During a ketamine infusion, that can be turned off immediately. And so you now have hope. And we can now water that and feed it, and it can grow. So it's just the beginning. There's a lot of new things coming, but I'm really excited about the future of mental health and where this is headed.
Absolutely. Now, I have to ask this question about the ketamine treatments. So we've talked mostly about depression during this, but we know there's other behavioral health issues, it's like schizophrenia or personality disorders. Does the ketamine help with those?
Can, yeah. Maybe not so much schizophrenia, but personality disorders. Yeah, personality disorder is basically learned behavior. And so if you think about it in terms of the brain's ability to adapt, there's some new research coming out that ketamine would help that quite a bit, which would be amazing because there's really not much CBT, for personality disorders. Also PTSD, anxiety, trauma. Ketamine can help with all those conditions.
So, Tim, I know you do a lot of work with hormone therapy and testosterone. Tell me about the benefits of that as far as men's mental health.
So, the hormones, they run the body. And we do know if the hormones are imbalanced, especially testosterone in men, testosterone crosses the blood brain barrier. It can help actually lift mood, improve depressive symptoms. Is it the be all end all to treat severe depression? No, but it can help. We have to do it in combination with other modalities, whether it is ketamine, traditional medicine, or there's one with magnets, kind of similar to the old-fashioned electroshock therapy, but instead of giving electrical shock, you're pulsating electromagnetic waves into the brain, which helps to rewire things too. So it's a combination of therapy. There's just no one good cookbook answer for everything. They're all ingredients for the same recipe.
Thank you. I think that gives the listeners some ideas of, hey, what can I put my arms around? And I think one of the things that you started with, Tim, was step one: reach out, tell somebody.
100%.
Thank you, guys. Appreciate you sharing that.